Cattle diseases: bovine viral diarrhea, mastitis, bovine spongiform encephalopathy.
Bovine viral diarrhea. This disease is caused by a virus called BVD virus that causes respiratory and digestive tract issues on cattle. This disease can affect cattle of all ages and can be seen predominantly on young ones as primary infection. In addition, this disease is one of the most widespread cattle pathogens worldwide. This disease can also be transmitted in numerous ways. First, it can be transmitted via contact with the infected cattle or the carrier of the virus, via contact with contaminated fomites, and it can also be sexually transmitted.
It is caused by bovine viral diarrhea virus or BVDV. It attacks the immune system of cattle, especially those cattle with a weak immune system.
After attacking, the virus will incubate for 3 to 5 days. Infected cattle with this type of disease are prone to dying if not vaccinated. However, if treated quickly, cattle will recover in about 1 to 2 weeks. Preventive measures for BVD. First is increasing the usage of antibodies. Cattle that are injected with antibodies shed only small number of virus for a short time period when infected. Second is culling infected animals from the herd. Through this, it decreases the contact and the risks of infection and it reduces stocking density. Third is vaccination. It decreases the proportion of susceptible cattle. It will provide sufficient immunity to prevent the clinical onset of acute BVD. However, in order to maintain the immunity, it needs to be given at least annually for modified live vaccine and every 4 to 6 months for the killed vaccine. Fourth is biosecurity and monitoring. Maintaining a closed herd and monitoring the enter of the new cattle may reduce the possibility of spreading and in contact of the virus. Another way to minimize BVD transmission is by increasing antibody titer, which makes the infected cattle less infectious.
While this virus has no cure, practicing supportive therapy such as increasing feed and water intake will temporarily help to improve the well-being of your cattle. Infected calves should be pulled to prevent the spread of BVD.
Mastitis. This disease occurs when microbes enter the teat of cattle via teat canal and causes contagious spread of pathogen during the milking stage. This disease also causes inflammation of other tissues and mammary gland, and it is a bacterial disease on dairy cattle worldwide. It also causes the reduce on milk production and alterations in milk composition which are common in US, Canada, and Australia. It can also be transmitted through the contact with the milking machine and oral to other transmission of calves feeding on milk.
Mastitis is caused by a virus species of streptococci, staphylococci, and gram-negative rods called coliforms.
It is the most common disease in cattle. It is a condition where it triggers an inflammatory reaction, particularly on the mammary gland of the cow. There are numerous ways to prevent mastitis. First is maintaining living conditions. Stalls and lunging areas should regularly be cleaned and maintained. It is crucial to have a clean, dry, and comfortable living area. Cows should be provided with clean and dry beddings since having dirty others makes the cow more susceptible to developing mastitis. Second is proper milking procedures. It is also important to milk cattle in a stress-free environment. Anxious or excited animals can't relax and may not let all their milk out. A quiet environment is advised, and it is also suggested to have a calm background music. Feel free to pause and read the following procedures of milking a cow that should be adhered to. Third is milking equipment maintenance. It is important to establish a routine of checking every equipment from time to time. Fourth is follow-up tit dip. Apply tit dips to cows after milking before returning them to their shelters. Fifth is to apply a drying off treatment. Whenever a cow reaches the drying off stage, administer a dry cow treatment to all 4 quarters. Sixth is to treat clinical cases from veterinarian recommendations. By using a strip cup, mastitis can be identified early. However, when mastitis is discovered repeatedly in an animal, the veterinarian should be contacted as soon as possible to determine the cause and source and to manage a treatment plan. Seventh is culling. There are times when it is necessary to kill an animal, especially when it is done to save the herd. The following situations identify criteria for culling an animal. First, are cows that don't respond to treatment. Second, are animals that are repeatedly infected, as they could be considered carriers and spreaders of the disease. Third, are cows with other damage, such as ones with lost quarters.
Treatment of mastitis have two main goals. First, returning milk to normal with an acceptable cell count so that it can be sold again. Second, getting rid of the bacteria. There are two main options as basis on treatment regimes: the intramammary antibiotics, the classic mastitis tube, and systemic antibiotics given by the intramuscular or subcutaneous route. For the antibiotics, intramammary antibiotics should be the first-line treatment for cows, usually in mild cases, while systemic antibiotics should be used when more than one quarter is affected, when changes on the other are marked, when the cow is visibly ill. Other methods are the non-steroidals. These are aspirin-like drugs that reduce the inflammation and pain caused by mastitis. They have proven very useful in severe cases of mastitis, but there is now increasing evidence of their usefulness in mild to moderate cases. It was also observed that cows treated with both intramammary antibiotics and non-steroidals had lower cell count, better cure rates, and better fertility compared to cows treated with antibiotics alone.
Here are some pictures of dairy cattle infected with mastitis.
Bovine Spongiform Encephalopathy. BSE is also known as mad cow disease that causes progressive neurological disorder in cattle, which resulted from the infection of transmittable agent called prion. It was first discovered in UK in 1986, and it can also be transmitted via the contaminated feeds of cattle.
BSE is caused by a misfolded protein called prion.
It is a slow progressing disease where it attacks the brain of the cattle and would cause a change on the physical behavior. BSE currently has no available vaccine to prevent it. There is also no reliable way to test if a live cow has BSE. Scientists identify it by looking at the dead cow's brain by using a microscope. Instead of preventing the cows from having the disease, the government prevents meat from infected cows from reaching the markets. To know more on how to prevent the possible spread of the disease, check out the link.
For the BSE, it takes an average of 4 to 6 years since the cow became infected before symptoms of the BSE first shows. This is called the incubation period. During this period, there is no possible way of telling if the cow is infected just by looking at it. Once symptoms start showing, however, it takes about 2 weeks to 6 months before the cow dies. The cow would become sicker and sicker as time goes by until it dies. There is no currently known treatment for BSE and no vaccine to prevent the disease.
Here are some pictures of cattle infected by BSE.